Good morning, ma'am. Ako ay si Justin Rama, ang junior clerk nga nasa mo karon. Ang procedure natong buhaton kay ginatawag na speculum exam. Mo-involve na siya og pagsulod og speculum sa imong kinatawhan aron makita nako ang sulod kung normal ba siya tan-awon or dili. Apil na pud ani na exam ang pagkuha nako og samples na ginatawag nga pap smear. Dili makita sa pathologist kung nabay abnormal na pagbag-o sa imong cervix na dili makita gamit ang mata lang. Ma'am, medyo uncomfortable ni siya pero dili ra kayo ni magdugay. Ingnalangon niya ako ma'am ko din jud makaya kay akong undangon. Okay ra ma'am? Sige, magsugod na ta ma'am ha. Panghilang daan dito sa CR niya, magsugod na ta. Place the patient in a dorsal lithotomy position. Choose the appropriate speculum size for the patient. Put on gloves and observe a septic technique throughout the procedure. Warm and lubricate the speculum. Part the labia using the non-dominant hand. Then using the dominant hand, insert the speculum by placing the transverse diameter of the blades in the anterior-posterior position and guiding the blades through the introitus in a downward motion with the tips pointing toward the rectum. Once the blades are inserted, the speculum should be turned so that the transverse axis of the blades is in the transverse axis of the vagina. Open the blades midway through the vagina to avoid hitting the cervix. Once the cervix is visualized, the speculum is opened and the introitus is widened. This can be done by using the screw adjustment on the base of the speculum. Examine the cervix and vaginal walls. Take note and report any visualized vaginal discharge, noting its color, consistency, adherence to walls, and odor. Also take note of the presence of erythema, lesions, erosions, and bleeding. Sample the endocervical canal with a cotton tip applicator or cytobrush, which is placed into the canal and rotated. The material obtained is then smeared thinly on a microscopic slide by rotation of the swab or brush on a glass surface. This is labeled endocervix and fixed immediately either by using a spray fixative or by immersion of the slide into a fixative solution. With the airy spatula or some variation thereof, the entire transformation zone is scraped and the sample is smeared thinly on a second slide, which is immediately fixed and labeled transformation zone. Unlock the speculum and gently close it. Remove the speculum in the reverse sequence. Ma'am, base sa akong nakita, wala ra may abnormal na pagbag-o sa mga vagina ug cervix. Ang hatong buhaton karon, maghuwat lang ta na mabasa sa pathologist ang nakuha nako nga samples. Ang resulta ani makuha within 5 to 7 working days. Nara kay mga pangutana ma'am or ganahan ipaklaro? Okay, salamat ma'am.